Start. Hello, my name is Dylan Hoffman. I'm a first year DAT student in Indiana State. With me today is Marie Charpentier. Marie, you want to tell everybody a little bit about yourself?
Yeah, so I'm a PT ATC that currently works at Houston Methodist in Sugar Land, and I'm the coordinator for our athletic training residency program and sports physical therapy residency program.
Awesome. So today we're talking about evidence-based practice, and that's kind of what this video will be about. So my first kind of question for you is just how would you define evidence-based practice, and what are your kind of thoughts on it in general?
Yeah, that's a great question because I think, evidence-based practice has kind of, in some circles, become a cliche term, and then in some circles, it's more of like a glamorous term, right? But I would say from a clinical standpoint, evidence-based practice is using evidence to help guide your treatment, whether we're talking about as a physical therapist or an athletic trainer or even as a physician.
Awesome. So when were you kind of first exposed to the idea of evidence-based practice?
Sure. So, I would say from undergrad, even though I didn't go through an accredited AT undergrad program, I'm really old. I went through the internship route. But at UVA, they had a doctoral program and a master's program in athletic training. And so part of my undergrad program was in sports medicine. And so I was being taught by the PhD athletic training students at the time. And so obviously they were big on evidence-based practice, even from undergrad. I would say the bigger emphasis on evidence-based practice, at least from an educational standpoint, came in physical therapy school. But even working in the training room at UVA, we would talk about using evidence-based interventions, whether that be, talking about evidence for the use of modalities, evidence for the use of manual therapy, or evidence for therapeutic exercise with certain intervention or certain diagnoses.
Awesome. So in your workplace now, in a clinic setting, what are some ways kind of recently that y'all have implemented some evidence-based practice techniques into your current workplace?
Yeah. Being a teaching facility and having multiple residency programs, we're obviously talking about evidence-based practice every day. We're using it during our mentoring, whether that's with the AT residents or with our PT residents. As far as specific evidence-based practice, we've been talking a lot about the evidence for treating tendinopathies. Like that's become really popular lately. And then, as far as including isometrics and then slow, heavy resistance and then eccentrics, and when do you use each of those, and what does the evidence say about when you should use each of those? Trying to think. I think tendinopathy is probably the biggest example, other than just what we do in the residency program as far as teaching and our mentoring process.
Right. Awesome. The last question I have for you is kind of related to that. So when you are implementing kind of evidence-based medicine into your practice, what are some of the challenges that you see when you're trying to implement some of that newer stuff?
Yeah, I think even before we talk about implementation, I think the biggest barrier is time to dig into the evidence, right? Because, we're busy clinicians. I think also being mentors and educators in the residency program, then we do have some time built in, or you could even think of it as forced time, right? Like if I'm going to teach this stuff, then obviously I need to be in the evidence because I want to be teaching the most current information.
Right.
But for those, and I think for athletic trainers that aren't in an educational setting, their days are really long and busy, and it's hard to commit time to getting into journals and reading. I think ways to get around that barrier, I think Twitter and even Instagram now are good ways to help skirt that barrier, right? Because you're flipping through Instagram or Twitter anyways. So follow people that are going to give you that evidence, that are going to give you these little nuggets. And, people are posting articles or little snippets about articles, or they're going to cite what they're putting on that. So that's how I like to kind of stay up with the evidence. As far as implementing it in the clinic, I would say sometimes there can be a disconnect between what you read in the research and then that patient or athlete that is in front of you. And then you can take that a step further to what resources you have in the environment that you work in. Again, I think those are just excuses, and we can find ways to get around some of those barriers. And, when we're talking about evidence-based practice, research is one component of that evidence-based practice stool. But we've also got to take into consideration the patient and even, your values. But again, I think there's ways to get around that.
Awesome. Well, those are great answers. And I want to thank you again for taking the time out of your day. I know you got a busy schedule, so I'm glad you could find a few minutes to talk to us.
Anytime. Thanks, Dylan.
Thank you. Bye-bye.